Healthwise FAQ.
It's Healthwise FAQ on Body and Soul Upsized, and the final and fourth part of our Ebola special this week with me, Daniel Martin. Thanks for joining me. Now, in the latest news, what we do know is that consignments of experimental Ebola drugs have arrived by plane in Liberia, for example. We also have heard, unfortunately, that somebody else has succumbed to the Ebola virus. Another doctor, it's claimed another doctor in Sierra Leone, and has succumbed to the Ebola epidemic. Now, what we're seeing, of course, and a lot of the news reports and the updates that we're seeing is that this is potentially one of the worst outbreaks spreading in its 4-decade history. Talking to us about this issue is Dr. Leong Ho Nam, who is our infectious disease specialist from the Rofi Clinic based at Mount Elizabeth Novena. We've seen another doctor succumb to this today, Dr. Leong. As doctors are frontline, remind us what is necessary in terms of protection for doctors and healthcare workers at the front line.
We have to think about protecting the body fluids from being passed on to us. So we're talking about gowns, we're talking about gloves, we're talking about hair covers, we're talking about eye shields, and we're also talking about the face mask. That's most important. So if we cover ourselves and we encounter the patient, they'll be fine. The next point where the person with the virus can actually pass on to us is when we remove the gown. When we remove the gown, sometimes we are a bit shoddy, we're trying to rush for an appointment. We will take off the gown and contaminate the clean areas accidentally with dirty hands or dirty gowns. So it's about protecting yourself with a barrier, covering all surfaces where the virus can pass over, such as the eyes and the mouth, and you'll be fine.
And I do understand that international organizations like the WHO have consultants on site to help educate and spread this kind of behavioral practices amongst the nurses and the doctors. So this has to continue and really be more of a large-scale scenario so that all the doctors and healthcare workers are not taking it for granted.
Absolutely. That is actually the key defense. Remember that we don't have a vaccine, and treatment, which we talked about yesterday, is not very good and is still on trials.
Now, what do we need to know in terms as well about the practices when it comes to disposing of the bodies? Because we know that in some of these Western African countries, there are cultural, behavioral practices where the body is cleaned and prepared for burial, sometimes within 24 hours, for example. This also has to be a cautious process, yes?
Spot on. The body fluids will be released from the corpse after death. And this body fluids will have the virus, and it can contaminate the people handling the body. So the people who handle the disease needs to be well-trained, well-covered. In fact, there will be so much production of these fluids, it can be a major contamination. It doesn't help when there are weeping relatives who will just cling onto the body and forget about the infection protection protocols. So in Singapore, should this event happen, I would foresee that only a few mortuaries will be able to handle the body. Number two, we will expect a very immediate or next day. What's the word for that?
Burial?
Not burial. It will be. He will be. It will not be a burial. It will be a cremation. Yes.
Ah, that's what. We both.
It will be a next day cremation, very immediate for the deceased.
Wait, so how long is the body still going to be, able to contaminate? The virus is still active for a long period?
It can. There's the body fluids. As long as it's in the body fluids, it can still pass on. The virus doesn't live very long outside in the environment, but while inside the body fluids, in the disease, it can still potentially pass on to those who handle the disease.
Okay. Dr. Leong, to wrap things up, we did have a report talking about how that experimental drug has arrived in Liberia. We're talking about doses of up to 1,000 of the drug ZMapp. 2 boxes apparently on a commercial flight landed with this in Liberia. Is this going to make any large difference, do you think?
No, I don't think so. Number one, we don't really know if it really works. I do pray that it works. Then number two, this drug must be given fast and early for the best results. And number three, and trying to identify the patient will be a challenge, and you could end up wasting all these precious medications on some cases which weren't due to Ebola. So even though you may have the vials, it may not work, or it goes to the wrong patient, or we are not starting early enough.
We do know that the disease has continued to spread. It's over 1,000 deaths right now across 4 countries. And Sierra Leone feeling the brunt of it, most of the confirmed and probable cases in that area as well. Are we going to see over this week, have we seen any improvement, or really has it unfortunately kept the pace in terms of what an infectious disease would spread like?
I think it has shown some restraint, and I think the border controls and the screening of people leaving the country and leaving the hospitals have improved, and that has somewhat controlled the spread of the epidemic. On our part, I think it's important that we avoid these phases, and should someone come over from those countries and turn unwell, they should see the doctor straight away and inform the staff. This is not a time where we hide away history. This is not a time where we try to keep quiet about illness if we've been to areas that over there. If you do know of someone who's been there and is unwell, that person should see the doctor immediately.
The responsibility and onus is on each and every one of us. Dr. Leong, it's been a pleasure. Thank you for your time all this week helping us understand Ebola.
Thank you very much, Daniel.
Dr. Leong Honam is our infectious disease specialist from the Rofi Clinic based at Mount Elizabeth Novena Hospital. That does it for our Ebola special on Body and Soul Upsized on 938 Live.
Healthwise FAQ.